everyone. I'm Audrey Barnes. I'm the Communications Director for the City of Laurel, and I'm the host of this Laurel Community Spotlight podcast. You can find this edition wherever you listen to your favorite podcasts. There's also a version of it with video that will appear on Laurel TV and also on our Laurel TV official podcast YouTube channel. We're going to get you caught up today on all of the quality healthcare that is happening at the University of Maryland Laurel Medical Center. If you've watched it spring up at the corner of Van Dusen Road and Conti Road, you'll want to stick around and find out about all the wonderful medical care that is available there. So I'm joined today by two very special guests. Dr. Gloria Oniha is the Senior Director of Nursing and Operations, and also Dr. Louisette Vega is the Medical Director of the Emergency Department. Thank you so much for being with me today.
Thank you for having us.
It's important to get the word out about what's going on there at the new medical center. So, Dr. Oniha, let's start with you. This brand new facility just sprung up, June of this year. So what kind of services are now available there? What's different?
Thank you, Ms. Barnes, for having us this morning. Yes, the brand new facility was opened on June 4th this year, and we are so excited about what's happening there. In addition to the emergency department, which is 24/7 outpatient surgery and outpatient behavioral health, the new addition is actually adding primary physician to the building. We have internal medicine, and we have OB/GYN doctors, and also we have a fetal maternal doctor also in the building. These are new services that were brought into the building when we opened up on June 4th.
Okay, so people need to know that those are new services that are happening there at the new medical campus. So I know that that's not all that's going on. There's a campus development program in the works. Tell us a little bit about that.
Yes, so University of Maryland Laurel Medical Center currently sits on a 40-acre property. So as you all know, there's an old building there that sits on a 16-acre part of it. So the campus development is ongoing. Right next to the new building, which we already operate on, is a medical office building that is currently being built, and we are hoping to open that first quarter of 2024. In that building, we are going to have University of Maryland orthopedic surgeons work there. We will have radiology services such as X-ray, CT scan, MRI, and one of the big services that is coming there too is the VITA, which is a dialysis services. And we know as we have the aging population, these are the services that are key to our community, and more services to come as we continue to recruit other services to come into the building.
So that's good to know that is coming, and that's really where people will go to get some of the more routine care at the medical office building.
Correct, and the focus for the facility as a whole, the vision we have for the medical center is actually to promote wellness and preventive health, so that before someone needs care in a tertiary facility, they can access the services that we are currently offering to prevent our community, our residents from going from needing a tertiary care. So if anyone has, let's say, a routine doctor visit, needs to follow up, do an X-ray or for pneumonia or something, these are the services that we will be offering there, so that we can at least maintain a more healthy population around us. And of course, if tertiary care is needed, we also have the process for that to happen.
What's going to happen to the old facility?
Oh, yes. As we speak, we're cleaning up the old building as we speak, and that old building is going to be coming down, and we're hoping that may happen the first few months in 2024. And as we bring that building down, so that we can have build other services, wellness campus, as we would like to call it, to develop that for the needed services in our community.
Thank you very much for that.
Thank you.
And the emergency department is so important. And we see the ambulances going in and out of that facility. So, Dr. Vega, tell us about your emergency department. How active is it? What do people need to know about the emergency department at the Laurel Medical Campus?
I think it's really important for people to understand that it is a full-service emergency department. We are open 24/7. We have the services that most emergency departments have. We don't have an inpatient unit, but we have the ability to care for the old and the young, right, in a standard emergency department. As Miss Dr. Oniha stated, we have the ability to do MRI, CAT scan, and basic services.
That's great because people need to know that they can get emergency care there.
Absolutely.
Now we know there's no inpatient beds.
Yes.
There. So what if someone needs to be admitted to the hospital? What happens?
So we have the ability. So we obviously triage patients. The patients that are discharged, we discharge them and for follow-up with their primary care doctor. But patients that need to be admitted, we do transfer them. So we transfer them mostly to our mother hospital, which is Largo Cap region, or we transfer to other hospitals where there's bed availability. So we take care of that process. We stabilize them and transfer them to where they need to go.
So we know that one of the common things you hear, people visiting the emergency room, I was there for hours. How does your campus prioritize getting people in and out of the emergency room quickly?
So we prioritize because we want to see everyone as quickly as possible. That is always our goal. But we do have to prioritize patients based on their complaints. So when you have chest pain, shortness of breath, things that need an emergent intervention, we do have to prioritize those patients first. But our goal is to service the community and to get patients back as quickly as possible.
So one thing I really want to ask is, how do you know if you should go to the emergency room or maybe go to urgent care or something like that?
That's always a good question. I think the most important thing to understand is if you have complaints like shortness of breath, abdominal pain, chest pain, those are important for the emergency department because they're services that we can provide that unfortunately urgent cares can't. And I think it's also important if you're elderly and have significant medical problems like hypertension, diabetes, those are things that should be evaluated in the emergency department.
Okay. Well, we have to talk about cold and flu season.
Yes.
Right.
I know you both have, I've heard you both talking about children. In
Yes.
fact, Dr. Oniha, I hope it's not too much for me to tell everybody, you have 5 kids?
I have 4 kids.
4 kids.
Quadruplets. Yeah, 20-year-old quadruplets.
Wow.
Yes.
Okay. So you've been through a few colds and flus over the years.
Oh, yes.
And I've heard you mention someone playing like on a big, huge soccer team and all that. So you've had that going on too. So it is cold and flu season, COVID season.
Yes.
What do we need to tell our families, our neighbors, our friends about cold and flu season?
Well, it's important to understand that with COVID and flu, you can't tell the difference between those two illnesses. The symptoms are very similar: fever, cough, shortness of breath. It's really important to understand that that because those symptoms are so similar, you always want to be careful with your vulnerable patient population. So the elderly, pregnant, really young. So if you have a cold, you want to stay away from those patients because of the risk factors because of the risk of those diseases. But to answer your question, there really is no ability to tell the difference with your symptoms in those two illnesses. And then reasons to come to the emergency department are persistent fevers, inability to keep things down. So if you're vomiting, as well as the most important, which is shortness of breath, those need intervention. Those need further evaluation, like an emergency department.
Are you seeing an increase in patients coming to the emergency
We
department?
are, but we haven't hit the peak yet. So it's it's just starting. The season is just starting. So we're getting flu and COVID, but not as much as it can be.
And they always talk about the triple threat between the flu, COVID, and RSV.
Yes.
So is that what all of us as parents really, and people with elderly
That's exactly
parents,
right.
because I care for my parents who are both in their 80s, and so they're going to get their RSV vaccine.
Yes.
And that's available for anybody over 60, right? Or recommended for people over 60?
Yes.
So we need to be aware of the triple threat.
Absolutely.
Definitely.
Absolutely. RSV, definitely, we're seeing RSV in the kids and the elderly. So they're the vulnerable patient population. So yes, it's important, incredibly important.
Have you been able to track your 20-year-olds down and get their shots as well?
Yeah, I'm successful with 3. I still need 1 to get his shot.
Mom is looking for you. She's coming for you to get all those shots. It's important. We
Absolutely.
have to stay
Yes,
on top
absolutely.
of all
Definitely. Yes. And one thing that Dr. Vega
Yes.
forgot to mention is the observation.
I was just going to say.
We do have.
I apologize.
Go ahead.
So it is really important that we do have the ability to monitor patients for 24 to 48 hours. So things like chest pain, things like abdominal pain, asthma, pneumonia. Those are things that we're able to keep at Laurel's in our observation unit. So we do have a 10-bed unit that's managed by the emergency department staff. And it's those are, and also some surgical patients.
Correct.
So we're able to keep them and manage them at Laurel as opposed to having to transfer them.
Okay, that's important for
Absolutely.
people to know. Is there anything else that we should tell the community right now about the University of Maryland Laurel Medical Center campus right there? Because this is an initial interview and podcast. I expect us to be continuing this conversation. So as you guys grow, we can get that information out to the community. But right now, is there something you
Yes.
want to share?
Yeah, there's a service that one of the services we are proud of. Of course, we are proud of many services
Yes.
there. It's our outpatient behavioral health services, which is our partial hospitalization program. So this service is geared towards patients or clients, we call them clients,
Yes.
that don't quite meet the criteria for inpatient behavioral health management, but they can benefit from outpatient services. So these services is for anyone that have a behavioral health need, and they have to be referred, of course. And it's a program. It's not an in and out one visit. It's sometimes up to 6 weeks program, 3 weeks program. It can be a 6 hours or 6 hours a day, or 3 hours a day, Monday through Friday. So it's an in-between program between an outpatient and a patient that is home being managed. So this is a service that we're so proud of, and is growing. As we all know, post-COVID,
Yes.
we saw a lot of behavioral health needs, even among medical personnel staff, just going through that whole COVID season, the trauma on family and friends. So this is a service that we really want to put out there that is available.
I know that the community will be really interested in those behavioral health services. I hear our police officers talking about that a lot
Yes.
this time of year during the holiday season. And as you said, post-COVID, if you're struggling, you can get help.
Absolutely. We also have the PLC, which is a counselor within the emergency department that's able to provide services and counseling, and ultimately if a patient needs to get admitted, so they can refer them to outpatient resources. They can also, the behavioral health, the partial hospitalization program, and then the PLC can also facilitate transfers to inpatient for those patients that come to Laurel. So it's a huge resource for mental health illness for the community.
And just what she said makes a huge difference with all that freestanding emergency department that you may find around. To have that behavioral health social workers within the ED is unique to Laurel Medical Center. So again, these are some of the services we've added to enhance what we can do in our emergency department.
Well, I mean, I think we've gotten some really great information out to the community, and I want to thank you both, Dr. Oniha and Dr. Vega, for being my guests today on the Laurel Community Spotlight. Now, as I mentioned, I want to remind you that this podcast is available on any platform that you listen to your podcast, and we're also going to be putting a video version of it on Laurel TV. So if you live within the city limits of Laurel, you'll be able to watch it on channel 996 or 71, or Verizon channel 12. And also, you can watch it on our YouTube channel. That's the Laurel TV official podcast YouTube channel. I'm Audrey Barnes. I'm the host. Thank you so much for tuning in.